Hello everybody and everybody else. My name is ScrypKat and this is ScrypKat Says. On this channel we take a look at First Amendment auditors, sovereign citizens, cop watchers, cop baiters, and Karens from a slightly different angle. If you're new here, welcome. If you've been here before, welcome back. I read every comment I receive and appreciate every one of them. You all have given me many great ideas. Keep your eye on the channel. You might see one of your suggestions come to life. It has been pointed out to me that I am not a psychiatrist or psychologist or even a certified counselor, and this is true. I make no claim to these fine titles. However, I am a retired registered nurse who has seen a lot of people in my 41 years of nursing practice, and I am fascinated by what makes people tick. As I watch videos which pertain to First Amendment auditors, frauditors, sovereign citizens, SovCits, cop watchers, and cop baiters, it is clear to me that most, if not all, suffer from various psychological imbalances. I make no claim to be able to diagnose or treat anyone of anything. I simply present various disorders and syndromes and relate them back to the folks we watch. Having said all that, I have found a few psychological diagnoses which these folks seem to fall into. Again, I am not a doctor, but I can read and I can relate what I read about to folks we meet or just watch. I am indebted to Dr. Ken Landau for his discussion regarding antisocial personality disorder. As he's describing this disorder, how many of our friends do you see?
Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about the antisocial personality disorder. Well, first of all, it's a personality disorder. So what's personality disorder? Well, that's an enduring pattern of behavior that's inflexible and it's pervasive. It occurs throughout a person's life in occupational and social and personal activities. It's stable and it's of long duration, tends to cause significant impairment clinically, selves and others, not accounted for on the basis of a psychiatric disease like schizophrenia. It's not associated with medical disease, not due to a medical disease like substance abuse, not due to head trauma. Well, personality disorders, of which there are 10, are subcategorized. And in cluster B, those are the 4 personality disorders where there's dramatic and emotional and unpredictable interactions that occur with others. And in this group, that's where we find the antisocial personality disorder, narcissistic personality disorder, histrionic personality disorder, and borderline personality disorder. And these share some similar symptoms. But interestingly, the antisocial personality disorder is the one that can't be diagnosed during childhood. During childhood, people suffer a different condition. They suffer the conduct disorder, a condition called conduct disorder. There's a problem, and the problem is in diagnosis. How do we make the diagnosis? Well, there are no standard ways to make the diagnosis. There are no standard tests or serology, blood tests. There are no x-rays, no electroencephalography. And unfortunately, at least here in America, the American Psychiatric Association keeps changing their definition of what the condition is. So what is the basis for antisocial personality disorder? Well, it's manipulativeness. So use of seduction and charm and glibness and other behaviors to ingratiate themselves to obtain their personal ends. These people tend to be dishonest and they're fraudulent. They misrepresent, they embellish themselves. They tend to be callous and lack concern for the feeling of others. They lack the feeling of guilt. They don't have any remorse. They tend to be aggressive and oftentimes sadistic. Now, not sexually sadistic necessarily, but sadistic, meaning they harm others and they take some enjoyment from that. And they tend to have hostile personalities. They have angry feelings. They react poorly to minor insults. They tend to be mean and nasty and vengeful in their behavior. And they have a disregard for their obligations. They make promises, they don't keep them. They have financial obligations, they don't follow through on them. They tend to be impulsive. They act on the spur of the moment. They act and they don't really have any plan for action on the basis of whatever happens. They tend to take a lot of risks. They take risks and they don't even regard the consequences. They tend to get bored easily, but unfortunately their boredom causes them to act impulsively. They also get an egocentric behavior where their self-esteem that they derive from the personal gain or personal power or pleasure. They have goal setting that's based on their personal gratification and failure to conform with social norms or lawful behavior, ethical behavior. These people have a lack of concerns for the needs or the suffering of other individuals. They have problems with intimacy. They have difficulty with marriages. They tend to engage in exploitive reactions with other individuals. They often use dominance. Not concerned for the feelings of others. Another would be gross and persistent attitudes of irresponsibility and disregard for social norms or rules or obligations. Others, incapacity to maintain enduring relationships. They can establish relationships, they just can't keep them. These people have very low tolerance for frustration, and when they become frustrated, they tend to react with aggression and with violence. They don't have any capacity to express guilt. They don't experience any benefit from having made an error and then growing because of it, and they tend to blame others because of whatever actions that seem to cause them negative input, or they rationalize their behavior. Now, these people tend to be persistently irritable. Sometimes these people are referred to as amoral or antisocial. It's a relatively common condition.
Well, that's not disconcerting at all, is it? Sorry for cutting you off there, Dr. Landau.
About 1 to 4% of the general population, with men manifesting symptoms of antisocial personality disorder maybe 3 to 5 times more frequently than women. If we look at people with antisocial personality disorders as adults, they manifest signs of the conduct disorder during their childhood. These people also seem to have difficulty with their IQ. They sometimes have reading difficulties. The peak age for manifestations tend to be somewhere between about 25 and 45 years old. And the manifestations are somewhat decreased in people over age 45, but those statistics come from a criminal population. In people who aren't involved in the judicial system, we don't have any real good evidence for the condition decreasing as a person gets older. Well, one of the reasons that we have a decrease in the incidence as people grow onto their later years is because these people have a higher all-cause mortality rate. They die off more early than other individuals. So what's the prognosis? Well, these people are unlikely to seek help. They seek help when they run into problems with authority and they're jailed and they're sent to see the psychiatrist, or the family sends them because of some other kind of problem like the anxiety or the depression or the substance abuse. Criminality, that occurs, but tends to decrease over a period of time. As we mentioned, that the treatment, unfortunately, we don't have any good treatment for the underlying personality disorders, whatever they are at the present time. They just seem to be resistant to any change, whether it's medical or whether it's psychological interventions. What's the prognosis of the condition? Well, there's a small chance that the condition will remit, about 25% over a period of time, but about 30% they'll improve a little bit without remission, about 40–50%. They're going to show no manifestation of improvement. These individuals are going to be hard to deal with. They're going to have difficult time with their families, with their friends, with their work environment. And that's the story basically of antisocial personality disorder, often referred to, as I said, psychopaths. Unfortunately, the condition causes a lot of havoc, leads to considerable harm, leads to harm in the individuals themselves and the people who interact with them. Seems to be associated with a variety of other psychiatric abnormalities like narcissism and anxiety and depression and sadism and borderline personality disorder. Now, don't try to comprehend the actions of people who have the antisocial personality disorder on the basis of what you would do or what you would think a rational person would do. Remember that the person is acting not as a normal individual, but as a person whose judgment is impaired by the underlying antisocial personality disorder.
Thank you, Dr. Landau. We certainly appreciate it. Okay, let's take a look at some of our friends and see what traits we can identify.
That kid was a runaway, a 14-year-old runaway.
It don't matter. Sir, back the up! Back the up, sir!
Oh, you're going to come to my traffic stop and yell at me?
Yes, I am. You're the one that's fucking approaching me.
I'm telling you.
Back the up! I have done nothing illegal here. You are law enforcement, not field enforcement, sir.
Where's your identification?
What for? What crime have I committed?
You have interfered with investigation.
No, I have not. I've got law books.
Where's your driver's license?
I'm not giving you my license. If you don't like it, call your superior right now.
Where's your driver's license?
Call superior!
Give me it right now.
I want your superior! Hey, get the phone, get a logger!
That kid was a runaway, a 14-year-old runaway.
It don't matter, sir. Back the up! Back the up, sir!
Oh, you're going to come to my traffic stop and yell at me?
Yes, I am.
Let me tell you
You're the one
something.
that's approaching me.
I'm telling you.
Back the up! I have done nothing illegal here. You are law enforcement, not field enforcement, sir.
Where's your identification?
What for? What crime have I committed?
You have interfered with investigation.
No, I have not. I've got law books.
Where's your driver's license?
I'm not giving you my fucking license. If you don't like it, call your superior right now. Call superior!
Give me it right
I
now.
want your superior! Hey! Call a lawyer! Call a lawyer! Hey! Call a lawyer! Help! Assault! I have broken no law! I'm not interfering. Babe, come and get my laptop. Call a lawyer. Babe, come and get my laptop and get a lawyer. I'm being arrested for, he says interfering. I want a superior officer. I want a superior.
Ma'am?
I want a superior.
Ma'am? Stay where you're at, because I'm going to get your information.
For what crime? Babe, did you get my computer?
Don't you just love it when they film their own crimes?
John, can I help you?
Yeah, I did an interview with a guy who lives on Block Island.
Yeah.
He says that 1,000 people in the winter live there, and that 500 of them are operating a meth lab. And he says that the ferry guys involved, hold on. He says that the state police back their cars up to the ferry and they load the meth into the state police cars. So the guy's in fear of his life.
So did he report it?
Did
he report it, John?
He's in.
What are you doing here today then?
I'm reporting it to you, and you're not going to do anything about it, and eventually you guys are going to go to jail. That's what's going on here. I've reported over 500,000 felonies to you guys already. Money laundering, check fraud, wire fraud, securities fraud. All types of new issue IPO fraud I reported. And what has happened is nobody gives us your name. Can I get your name? Can I get your name? Can I get your name? I'm fairly certain that when a federal officer is asked his name after a guy reports a federal crime, that you're obliged, your duty is to tell me your name. Tell me a case number. Tell me what's going on. I've called hundreds of times, and I've gotten lots of threats, that's for sure. So, the meth lab, I am told, which I came here to report, supplies Boston, New York, and the state of Connecticut. All of them. They got 500 people making meth. There's been numerous house explosions on the island, leveling the buildings, which you guys know about, because I sent it to you. So when you interview this guy who's hiding, he wants protective custody. He wants witness protection. He's begging for it. He says that many of the people in the criminal enterprise have been OD'd, given fentanyl, because they knew too much. There are murders involved, there is racketeering, of course, and the fact that the state police is involved is frightening. So now you know. I'll post about it later. You won't tell me your name. You guys never answer any questions. You never call us back. And basically, I'm running for U.S. Senate against Blumenthal, and I'm gonna send him a copy of this tape today. I can guarantee you that. I need to know your name. That's it. What's your name?
All right, John, I'll see you later, man.
What's your name?
You said you were done?
What's your name?
John, did you say you were all done?
I said, what's your name?
I know.
I'll be done when I get your
You're all
name.
done, right?
Huh?
So
Who's
you're
this?
done.
Who's
I'll
this
take
guy?
it. See you later, man. Have a good day.
This gentleman is Johnny Flynn, who is running for a U.S. Senate seat for the state of Connecticut. I don't know about you, but that's a bit concerning to me.
I'm threatening them. I didn't make no threats. All I said is pick up your fucking trash. That's it.
Okay, well,
That's it.
it takes two people.
It's called being considerate
Okay, then stop
of your
being.
neighbors.
Then why are you being so inconsiderate?
Why am I being inconsiderate?
Yeah.
Man, this conversation's over, man.
It always gets
This
turned
conversation's
on you.
over,
Always
brother.
gets turned on you.
See
Every
ya.
fucking time.
Come on, Vincent. This conversation's over.
It's because they're a bunch of retards.
Now I'm the
there.
problem. You hear this, Terry? I'm the problem.
Look at you and look
You
at
get that a lot?
I'm the problem, right?
Does that happen to you a lot?
That's crazy as fuck. What'd you say?
Does that happen to you a lot where people say you're the problem and you don't think you are?
Oh, it happens a lot.
Yeah, that's because you are the problem.
No, I'm definitely not the problem.
When it always happens,
I'm
it's because
definitely
you
not
are.
the problem.
Okay.
I'm sorry, y'all, but this is my favorite clip of all time. I just had to throw it in here somewhere.
Touch me, fool, and I'm a pepper spray. Touch me. Just touch me a little bit. Just touch me a little bit, and I'm a pepper spray, fool.
Okay, yeah.
Touch me a little bit. Right, Casey Camera Boy here, working on the First Amendment audit with Nancy and Nathaniel, and we got Grandpa Smurf over there. He's actually wearing blue. That's it. Let's see what happens here. Hi. How you doing today?
I don't wanna. Actually,
What is it?
can I turn off that camera, please?
No, don't. If you touch me,
Oh, okay,
I'm a
yeah.
pepper spray, fool.
All right. Can you turn off that?
What are you gonna do, fool? What are you gonna do?
I'm just asking. So why?
Don't
do you...
get on my face like that, fool. If you touch me, I'm a pepper spray.
I didn't touch you.
All right. Sir, you're 3 seconds away from getting pepper spray.
Oh, can you turn off the cameras, please?
Don't touch me.
All right, I didn't touch you.
I'm gonna suck you if you touch me.
Sir, you're in his personal space.
All right. I was just asking you. So, can you turn off the cameras, please, when I talk to you?
No.
Why not? Do you?
No. No.
Why not? I was just asking.
No.
Why not? I was just asking.
No.
I just asking. Why do you?
You can ask.
Yeah.
You can ask.
I asked you, but you didn't answer. That's why I just asked.
Yeah, I said you can ask, fool.
I just asking you. So why do you take a picture?
It's none of your business.
Oh, it's not. It's my business too.
Oh, is it a business?
Yeah.
Or is it a church?
Yeah, this is church.
Oh, exactly.
I'm the member of the church.
Okay.
So I don't know. I just asking why do you?
Is this how you treat people? Who wants to? Is this how you treat people who wants to come in the sermon? I'm gonna step back. If you get close.
Don't get in his personal space, sir.
Touch me, fool, and I'm a pepper spray. Just touch me a little bit. Just touch me a little bit, and I'm a pepper spray, fool.
Okay, yeah.
Touch me a little bit. Touch me a little bit.
I didn't touch
Get close to me, and I swear I got a pepper spray, fool.
I just asking you to turn off the camera first.
He doesn't have the camera. We're in a public place, sir.
Make me.
Yeah. I just asking you.
Make me. I'm telling you to make me. You didn't scare me, fool.
I didn't scare you. I don't have anything. You have pepper sprays, but I didn't have anything.
I don't give a f. That's your problem if you don't have If you can't afford anything, that's your problem.
I didn't do anything right here. I just
You touched me. You touched me.
I didn't touch you.
You touched me. You touched my rig. You touched my rig. You touched my rig, fool. You touched my rig.
I didn't touch
you touched my rig.
I didn't touch anything. I didn't touch anything.
You touched my rig.
You
touched my rig.
Don't stop saying curse.
You touched my rig.
It's pretty hard to pick up on, but Casey Camera Boy is calling this Asian gentleman a very derogatory epithet. It's absolutely disgraceful. Well, folks, we were able to find 5 of the 8 traits that the DSM-5 says defines antisocial personality disorder. Now, I'm not saying that each of these folks suffers from this psychiatric imbalance, but these traits sure show up a lot in our friends. I hope you have enjoyed this video. Join me next week when I once again take a look at what makes these folks tick. Bye for now.